Good afternoon. Welcome to HMSA's Quest Integration webinar. Thank you for taking time to attend today's session. Our training material today consists of a handout of today's slides, and we also emailed you a contact sheet and an evaluation form for the webinar. We request that you complete the evaluation form and fax it to us at the completion of today's session. We're looking for your feedback regarding topics that you would like to hear covered in future Quest webinars. Please place your computer or phone on mute for the duration of today's webinar. You may listen to the webinar using your computer audio or telephone. At any time, you may send your questions using the chat tool. At the top right side of your screen, select Chat. The chat box will appear on the right side of your screen. We've set aside time at the end of the presentation to answer your questions. I'm Paula Murray with HMSA's Provider Service Training Unit, and I will be presenting today's webinar. For today's agenda, we will be covering the following topics: provider enrollment and re-enrollment, excluded providers, member cost share, service coordination, referrals and pre-certifications, EPSCT, the Quest integration fee schedules located on HIN or HHIN, contact information, and of course we have set aside time at the end of today's session to answer your questions. To get started, we have a very important announcement for Medicaid Quest integration providers. There is a new requirement for providers enrolling in Medicaid for the first time or for established Medicaid providers who have not re-enrolled in the past 5 years. HMSA and MedQuest have sent letters to affected providers instructing them to submit a Medicaid application form, which is the DHS Form 1139. Send the application and other required documents to MedQuest, not to HMSA, and please do this as soon as possible. This is being done to step up an anti-fraud measure in the program. If you were notified by HMSA or MedQuest, it is extremely important that you take action now to ensure future payments are not interrupted. As part of the enrollment process, all affected providers must submit the documents on this slide: the Form 1139 provider application, copies of any licenses and certifications, your W-9, and copies of your general excise tax license and certificate of liability insurance. All providers also allow MedQuest Division to conduct on-site inspections for all of their locations. In addition, home health agencies, durable medical equipment, home and community-based services providers, hotels, and transportation providers submit a $500 application fee. Individuals with 5% or more business ownership must be fingerprinted and have a background check completed by FieldPrint. And you can go to the website you see here for instructions. Institutional providers such as hospitals, nursing facilities, and pharmacies must also submit a $500 application fee, but they are not required to undergo the fingerprinting and background checks. Be sure to send all required documents along with your $500 application fee for those providers identified on the previous slides to the address you see here on this slide. Your prompt attention to this is greatly appreciated. The application form, instructions, and additional attachments for specific provider types are located at the URL here on this slide. If you have questions, please call or email MedQuest directly. Described simply, Quest integration members fall into one of three groups. We have our non-ABD, which does not include the aged, blind, or members with disabilities. The second group is ABD, which includes the aged, blind, and members with disabilities. And the third group is the ABD and LTSS. And these are the aged, blind, or members with disabilities who have additional LTSS benefits. Members in this group have additional benefits to support their special needs. The member's card will show which group they belong to, so you can easily determine which benefits they have. As an excluded provider, an individual or entity who is not allowed to receive reimbursement for providing Medicare or Medicaid services. To be a part of HMSA's network, providers must warrant at the onset and for the duration of their contract that the provider and/or affiliated providers such as owners, agents, or managing employees are not excluded from participating in federal or state health programs. If found to be excluded, HMSA is required to immediately terminate the provider and/or affiliated provider from our provider network. In addition, providers must also warrant that they review the excluded provider list regularly to confirm that employees or contractors are not on any list and review excluded provider lists prior to hiring new staff. There are 2 federal websites and 2 state websites. These sites list individuals and entities who are excluded from government contracting and healthcare programs. While searching multiple lists is inconvenient, the lists are maintained for different reasons, so we provide the web addresses for each of them here. This slide shows lists maintained by the federal government. And here are the 2 lists maintained by the state of Hawaii. You should be checking all 4 lists to see if there are any individuals or entities who should be excluded from the program. Next, we'll talk about service coordination. Service coordination is a person-centered service delivery system that ensures the needs of those with special health care needs are met. When a member with potential special health care needs is identified, they'll undergo a health functional assessment, and if appropriate, they will be offered service coordination. Service coordinators will assist in coordinating services with other agencies, programs, and community services. Both children and adults with special health care needs are eligible for this service. Some examples include patients with chronic conditions, patients with frequent emergency department usage, patients being discharged from acute care, patients with recent hospital readmissions, and children with autism. These are just some of examples of members who may be eligible. Long-term services and supports are available for members that are at nursing facility level of care. Providers or service coordinators must complete the DHS Form 1147 Level of Care form for Quest Integration patients who may need nursing facility care or additional support to remain in their home or community. Following DHS review, members who are determined to be at nursing facility level of care may be placed, and members who qualify for home and community-based services have service coordination arranged for additional support services. All services must be arranged by the service coordinator. Members may have non-family caregivers that are able to assist with tasks while the patient remains at home. The member may opt for self-direction, where they employ the caregiver. The service coordinator will work with the member to determine if self-direction is appropriate. As the employer, the member must verify caregiver timesheets and submit monthly invoices to Quest Integration, and an hourly rate is paid to the caregiver. The DHS Form 1147 can be completed by either the provider or the service coordinator. Please refer to the service coordinator to complete the form when they are involved in servicing the member. This form cannot be completed by office staff. Only a licensed medical professional such as a doctor, nurse, practitioner, or a registered nurse can complete the form. Completing electronically is quicker to process than via a hard copy form. The at-risk program identifies patients that are at risk of deteriorating to nursing facility level of care. Service coordination is offered as an intervention to keep these members in place with additional benefits to help them remain at that level of care. Please note that members do not need to be age blind or disabled to qualify for the at-risk program. Service coordinators initially conduct a functional assessment of the patient. Based on the assessment, the service coordinator creates a service plan for eligible members and helps to coordinate services with providers, programs, and community agencies. The service coordinator will also monitor progress with the EPSDT requirements as applicable to the patient. Any member may be referred for service coordination. We ask that providers inform the patient that you are making a referral to service coordination so that the member is aware and they're expecting it when we call them. If you have patients who might benefit from service coordination, you may either fax a request form to HMSA or call the phone number listed here on this slide to get the process started. Now we'll move on to Quest integration members with cost share. What is cost share? Certain individuals may not meet Medicaid financial eligibility requirements. However, they may qualify for coverage if they agree to pay a monthly cost share amount towards their coverage. This amount is determined by MedQuest. Certain provider types are responsible for collecting a member's cost share and entering the cost share amount when filing claims to HMSA. These include the entities listed here: nursing facilities, hospital wait list, personal assistance, adult day health and adult day care, skilled or private duty nursing, community care foster family homes, expanded adult residential care homes, and respite care. HMSA service coordinator will notify the provider of a member's cost share and the amount to be collected. Cost share information is also available on the MedQuest eligibility website or by calling the Quest Integration Provider Service at the number on your screen. When filing claims, the member's cost share amount must be entered on the provider's claim. For the UB04 claim form, place value code 23 in form locator 39, and for the CMS 1500 claim form, you'll enter the amount in block 29 as shown here. Here we have an overview of the cost share process. The amount of the patient's cost share is determined by the state. HMSA service coordinator then meets with the member or their representative to explain their cost share and their obligation to pay this amount each month. They also have the member sign a cost share agreement. HMSA then sends a copy of the agreement to the provider who will be collecting the cost share. The provider collects the cost share from the member each month and indicates the amount collected on their claim. HMSA will then process the claim and will reduce the provider's payment by the cost share amount that they have already collected from the member. There may be instances when the member's cost share is greater than the claim. In this situation, HMSA will send the provider an invoice requesting that the balance of the cost share be sent to the address listed on this slide. So to reiterate, the member is always responsible for paying their cost share on the first of each month. The providers are given the option of having the amount of the invoice deducted from future HMSA payments. If there are retroactive changes to a member's cost share, claims will be reprocessed to reflect the corrected amount of the cost share for that month. Okay, moving on to referrals. This section will cover referrals for Quest Integration members. And I'd like to start by clarifying that pre-certification is separate from the referral process. We will cover pre-certification in the next section of today's presentation. PCPs are responsible for managing a member's health care and making referrals for specialty care. There are a few services for which members can self-refer, meaning they can see any network provider without a PCP referral. These services include outpatient behavioral health visits, family planning, refractive vision services, well woman exams, and mammograms. All other specialty care requires a PCP referral. Certain specialty services, such as those you see listed here, require the PCP to register the referral with HMSA. So those would include plastic surgery services, any off-island specialist services, as well as in-state, out-of-network referrals. Registering referrals may be done via fax, by registering services online using HHIN, or by calling Quest Integration Provider Service. If you're faxing a referral form, there is no need to mail a follow-up confirmation copy, and no additional supplemental reports are needed. Now we come to pre-certification. The pre-certification requirements will be discussed in this section, and it's necessary to ensure the appropriate use of selected services. A list of services requiring pre-certification is contained in the Quest Integration Provider Handbook. The list includes LTSS services, which include home and community-based services, long-term care confinements, and other services. Please review this list prior to rendering any of these services to verify if any services you render may require pre-certification. Be sure to submit your request before the services are rendered. For those of you who are already seeing Quest Integration members, you should be aware that some pre-certification requests are sent to our partners, such as NIA and EviCore. Their respective areas of responsibilities are listed here on the right-hand side. So we have HMSA's medical management, who will do pre-certification for medical surgical procedures, LTSS, post-acute care services, speech therapy, and out-of-state referrals. National Imaging Associates, or NIA, handles our pre-certification process for advanced imaging, spinal interventional pain management, lumbar, spine surgery, and selected cardiac procedures. And we also have EviCore, who handles our pre-certification for outpatient rehab therapy. Additionally, other requests are sent to Quest Integration Provider Service Department. For our Quest Integration Provider Service, you will send them requests for travel and lodging, in-state, out-of-network referrals. For CVS, you'll send them any drug pre-certification. And for behavioral health, you will send those to Beacon Health Options. For HMSA reviews, our pre-certification forms are available online in the Provider Resource Center. Links to those forms are provided here. There's a general pre-certification request form as well as a specific form for post-acute care services. After completion, the forms can be mailed or faxed to HMSA. We also have a phone number that you can call, and we also accept requests electronically using HHIN. These portals have links to iExchange, our online platform that allows submission of pre-certification requests and referral registration. Referrals to out-of-state providers must be approved by HMSA for the services to be covered. If you are interested in receiving training on submitting pre-certifications electronically, please note that on your evaluation form that you complete after this session and fax it back to us. If you're registered with the HHIN system, tabs for registering referrals and requesting pre-authorization are located on the left-hand side of the screen when you log in to HHIN. If you are not registered with HHIN and are interested in getting access, please call the number you see on this slide. Here we list in more detail those services that are managed by NIA or National Imaging Associates. So any MRI, MRA, MRS, PET scans, myocardial perfusion imaging, stress echocardiography, implantable defibrillators, pacemakers, and lumbar spine surgeries. These are all covered by NIA. We've also included here a link to the quick reference guide for the Quest integration program, as well as an NIA FAQ document. As a reminder, pre-certification by NIA does not apply to emergency rooms, surgery centers, observation, or inpatient settings. We encourage you to submit your request online through radmd.com. After establishing your secure login, you're then able to submit your request anytime, as this service is available 24 hours, 7 days a week. Clinical information can be uploaded securely rather than faxed. For services that are clinically urgent, which is defined as cases that cannot be postponed for 24 hours due to severe health risks for the patient, please use the number listed here for clinically urgent cases, or the urgent option if using RadMD, to provide information on the case, and that will expedite the processing of that request. eviCore is our partner responsible for pre-certifying rehabilitation therapy services. Providers need to register and log in at the website listed here. As I mentioned previously, Quest Integration Provider Service manages our in-state, out-of-network referrals, as well as travel and lodging requests. These may be requested via phone or fax at the numbers you see listed on your screen. CVS is our partner responsible for pre-certifying drugs. For oral or inhaled drugs, drugs requiring pre-certification are contained in our drug formularies located in the Provider Resource Center. Requests for oral or inhaled drugs may be submitted either by fax or phone. Injectable or infused drugs requiring pre-certification are listed at the website shown here. Most of these drugs have specific forms for requesting pre-certification. Providers with HHIN access can submit these requests online using the Novologix tool. Pre-certification can also be requested by fax or by phone, again at the numbers on your screen. As I mentioned earlier, Beacon Health Options is our partner for managing behavioral health services. Their contact information is included here. So for any behavioral health referrals to out-of-state providers, residential treatment, methadone, or LAAM treatment, you can contact Beacon directly. Timeliness guidelines are 14 days for routine pre-certification requests, although most requests are completed in a much shorter time frame. Urgent requests are handled within 3 business days. We understand that there may be instances in which a member may be retroactively enrolled into Quest integration. If services that require pre-certification have already been rendered for a member in this situation, go ahead and submit a claim for the services with documentation that supports the medical necessity. That claim will then undergo medical review. If you fail to include any documentation with the claim, it will be denied for no authorization, so be sure to include any supporting documentation. Okay, moving on to EPSDT, the Early Periodic Screening, Diagnostic, and Treatment. This section applies to primary care providers. EPSDT, or Early Periodic Screening, Diagnostic, and Treatment Program, monitors a child's health, development, and immunizations up through age 21. There is a global payment for these exams, and the PCP must submit a claim as well as the 8015 or 8016 forms to HMSA. The screening schedule is available at the MedQuest website, or you can refer to the age guide that's at the top of the EPSDT form. As the child ages, you'll see fewer exams are needed. But the top of the form will show you when the exams are expected, which are 14 days, 30 days, 2 months, 4, 6, 9, 12, 15, 18 months, and then it goes by the child's years of age, 2, 3, 4, 5, 6, 8, 10, 12, 14, 16, 18, and 20. Claims are billed with a preventive medicine CPT code and modifier EP in Block 24D. You'll also need to put a Y indicator in Block 24H, as you see here on your screen. If the claim is filed on a CMS 1500 form, go ahead and staple the EPSDT form to the claim. We will need both the claim and the EPSDT form in order for you to receive credit for it. If the EPSDT form is being billed electronically, if your claim is being billed electronically, the EPSDT form should be mailed separately to the Quest integration address you see here. It's important that the EPSDT form be received by HMSA by the time the electronic claim is processed. So be mindful of your timing when submitting your electronic claims. You'll probably want to go ahead and mail your EPSDT form at least 2 days prior to submitting your electronic claim to be sure we receive that EPSDT form by the time we receive your electronic claim. Original EPSDT forms are available from Conduent, and these forms may be ordered by phone or fax. In the event that an EPSDT is billed on the same day as an evaluation management office visit, only the EPSDT line will be paid. Or if you have billing on separate claims, only the EPSDT claim will be paid. The EPSDT forms can be obtained by either calling Conduent or faxing your request to them. Specific instructions for EPSDT services can be found at the websites, at the links you see here on your screen. And let's move on to talk about the professional fee schedule. Quest Integration participating providers agree to accept Quest Integration eligible charges as payment in full for covered services. While the last bullet refers to co-payments and deductibles, these will probably not affect Quest Integration members. And just as an aside, if the PCP is participating in our payment transformation program, they do have an alternate reimbursement methodology, so just keep that in mind when you're looking at your report to provider. Quest Integration fee schedules are available on HHIN. If you recall, this is a secure, password-protected website. You will log in using your credentials to view the fee schedules. Under Quest Integration, click on the Fee Schedules tab, and these include the most frequently billed services. HHIN has sections for Quest and non-Quest members. Under Quest, there are separate fee schedules for ABD and non-ABD members. Just as a reminder that the ABD stands for Age, Blind, and Disabled, so when you're looking at the fee schedules, keep that in mind. And what you have here is just a little snapshot of what the fee schedule looks like once you click on that link in HHIN. So you can see you'll be looking at Quest Integration fee schedules. Look for 2018, and it's separated by Medicaid ABD, and then it says Quest Integration for the non-ABD group. The information covered today is available through our provider communications in the Provider Resource Center, which is part of our provider portal at hmsa.com. Anyone can access the Provider Resource Center as no logon is required. There you'll be able to view the Quest Integration Provider Handbook, our Health Pro News issues, as well as other communications. We encourage you to view these resources, or at least familiarize yourself with where to find them, so when the time comes that you need to look, you'll know where to look for those things that you want to look up.